In several of our videos, we talk about exactly what Original Medicare covers and what it doesn't. One of the main gaps of Original Medicare is prescription drug coverage. So what do you do if you don't actually take prescription drugs? Stay tuned. Hi there, my name is Sarah and welcome to iHealthBrokers channel. Now if this is your first time to our channel, welcome. Make sure to take a look around because we've got plenty of videos about Medicare and health insurance in general. And if you have any videos you'd like to see, just let us know in the comments below. At iHealthBrokers, we are licensed health insurance brokers. So if you have any questions whatsoever, please feel free to give us a call here at iHealthBrokers at 888-410-0344. There's no charge for our services. We're licensed nationwide and we're licensed with over 200 carriers. Also, you can absolutely reach us in the comments below if you feel more comfortable. Now in today's video, we're going to be talking specifically about Medicare Part D, which is your prescription drug coverage. However, we do release these videos on a weekly basis, so please make sure to subscribe to stay up to date about Medicare and changes in health insurance because there are changes and we want to make sure that our clients and our viewers are as well informed as possible. And of course, please make sure to like this video because liking this video will make it more visible to others on YouTube who are looking for the same type of information. So in today's video, we're talking about what to do about Medicare Part D if you really don't need prescription drugs. And the crux of the question boils down to, do I enroll or do I not enroll? Let's discuss both options. So one of the reasons that people may enroll in Medicare Part D, even if they don't have prescription drug needs or extensive prescription drug needs, is to avoid the Medicare Part D late enrollment penalty. The penalty is calculated as 1% of the national base beneficiary premium times the amount of months without prescription drug coverage. In 2021, the national base beneficiary premium is $33.06. So right now, we're talking about 33 cents per month. Remember though, those premiums do tend to increase on a yearly basis, therefore, so does the penalty. The truth of the matter is, if you don't take prescription drugs currently, of course it's absolutely understandable that you may be wondering, why on earth would I enroll in a Part D plan if I don't need prescription drug coverage? Unfortunately, the sad fact is most likely within a few years you will need some type of prescription drug coverage. It's estimated that somewhere around 90% of senior citizens take prescription drugs, with over 50% having more than 4 prescription drugs. And those costs can really stack up if you don't have appropriate coverage. Additionally, that late enrollment penalty that we talked about, that gets tacked onto your monthly premium forever. But I don't want to scare you with this late enrollment penalty because again, we're really only talking about 33 cents per month without prescription drug coverage, or at least those are the numbers as it stands currently. So what we'd encourage you to do is run the numbers. Do you think it's going to be years and years, months and months without a need for prescription drug coverage? Even if you're looking at a period of about 3 years, right now that would be an additional $10 per month. So is that something that's a big deal to you? It really depends upon your personal needs, your preference, and your comfort level. And while we're talking about those low figures, something like an additional $10 per month, did you know that you can actually probably get a prescription drug plan for less than $10 a month or somewhere thereabouts? So let's log on to Medicare.gov to take a look. So here we are in Medicare.gov. So I'm just going to continue without logging in. And we're going to click over here where it says Drug Plan Part D. And we'll put in a Florida zip code. It's going to ask you if you get help with any of these programs. Right now I'm going to say I don't get help from any of these programs. And actually, since we're talking about not taking prescription drugs, we're going to say no, we don't want to see the cost of our prescription drugs. And here are the plans. So if you'll notice, the first plan that it shows us is actually only $7.30 a month. So that's less than that penalty than we were just talking about. Now, of course, they're going to go up from there. Here's one that's $13.50. And right now we are comparing plans. It's sorting it based on the lowest drug and premium cost. Let's just do just lowest monthly premium. Since we didn't put in prescription drug costs, it's probably going to be the exact same, but let's just take a look. So $13.50, $14.70, and it's going to continue going up from there. So what you can do, if you want sort of an intermediary solution, you want to maybe avoid that late penalty later in the game, and you want to make sure that you have some coverage should the unexpected happen, what you can do is log on to Medicare.gov and you can enroll in the least expensive plan possible. That way you save yourself the late enrollment penalty down the line, and you make sure that you do have some type of coverage should the unexpected happen. Now, you may get scared into enrolling in a prescription drug plan right now, even if you don't have prescription drug needs, because of that late enrollment penalty. But as we discussed, that late enrollment penalty is not that big of a deal. What can be a big deal is if the unexpected happens. If all of a sudden you find yourself unexpectedly in need of prescription drug coverage and you don't have it. Because if you're outside of your initial enrollment period and it's not that annual enrollment period yet, you may have to pay out of pocket for some pretty expensive prescription drugs. The other option, of course, is to not enroll, or at least not to enroll now, because as we've discussed, that late enrollment penalty can be pretty negligible dependent upon the amount of time you go without coverage. Now, of course, you're safer to have some type of prescription drug coverage, but we just don't want you to make any decision out of fear. In the meantime, should you need access to standard prescription drugs, there are ways to access some of those more standard prescription drugs at a lower cost. For example, there are pharmacies and grocery stores that will provide things like antibiotics, generic antibiotics, very often at low or no cost, even without insurance. Additionally, there are things like pharmaceutical assistance programs and state pharmaceutical assistance programs that can offer you assistance with your prescription drugs. Make sure to check out our video about how to make the most of your Medicare Part D for more information. And finally, with a little research and forethought, you can make great use of programs like GoodRx, which can save you a ton of money on your prescription drugs. In fact, even if you're already enrolled in Medicare Part D, or once you are enrolled in Medicare Part D, you may want to present both options to your pharmacist to see which is going to cost you less. So what it boils down to is if you choose not to enroll in Medicare Part D, obviously you're taking a little bit of a risk, but how much of a risk you're taking is entirely up to you. So make sure to do your research and stay informed so that you're making the best possible decision for you. Medicare Part D is arguably one of the most confusing aspects of Medicare. So please make sure to check out some of our other videos about Medicare Part D, which I'll put in the description below. And if you have any questions whatsoever, you can reach us in the comments, or you can give us a call here at iHealthBrokers at 888-410-0344. As I said earlier, we're licensed nationwide and there is no charge for our services. But something else that I do want to mention, Medicare Part D can be confusing, it can be frustrating, and sometimes people do find themselves unexpectedly being denied. So if we assist you in enrolling in a Medicare Part D plan and that should happen to you, just give us a call and we will handle it for you. As always, please make sure to like this video and subscribe to stay up to date because we're going to keep releasing these videos on a weekly basis. And if you have any questions, you know how to reach us. Thank you so much. Have a great day. Bye-bye.